What is up? This is yours truly, Walter Brown, registered veterinary technologist and social media content creator. And I am here with a special guest today as we do this United Veterinary Care podcast, as we sponsor some of our veterinary technicians and send some shout outs to our veterinary technicians that are doing some amazing work in the field. And I am excited because today is an exciting day because this month is Service Dog Month, and I have a special person here with me by the name of Amie Chapman, who is also a registered veterinary technologist, and she is the I guess CEO, founder of Growing Up Guide Pups. So I am excited to have her here with me today. Amie, how are you doing?
I'm doing great. As you can see, we're quite busy.
I see that. What first of all, before we get into anything, what is the bundle of joy that you have over there going berserk right now? What is this guy?
Uh, this is Trinity.
Okay.
This is one of 5 puppies we have currently, and they just turned
OMG.
6 weeks old this morning.
Oh, all of them.
All of them.
And you
Yes. So
have
we had a litter of puppies here.
wow.
I'm coming from you from our puppy nursery, which is AKA our spare bedroom. Um,
That
so,
is awesome. And what kind of
so
pups are they?
they are standard poodles.
Nice. They look so rambunctious, and you have all five, or is it six of them? Five.
We have 5. We have
Wow.
mom as well.
Wow.
So we purposely bred these puppies, and they will all be donated to service dog organizations across the country, and we even have one going up to Canada.
That is awesome. Okay, I'm sure we'll get into how all this started and whatnot, but let's just start with groundbreak. Like, okay, hey, how did you get it out? We've established that you are a registered veterinary technician. How long have you been in the field as a registered veterinary technician?
25 years.
25 years, and if I'm not mistaken, you've been at the same clinic for 22 years, correct?
25 years.
25.
The
Oh,
same
it's
clinic.
25. Wow. Whoa. So, like, the clinic you started at, you're still at right now. Man,
Correct.
shout out to that clinic because again, and it's North Peninsula, right? It is
Yes, it
that
is.
is that is awesome because again, for a person to be at a clinic for 25 years of their career, when it's hard to keep people in the field, that is just shout out to North Peninsula, and again, that is just extremely a blessing. So, how did you get into this guide dog stuff? Like, just give me the rundown. What happened? What made you say this is it for me?
The quick story is was I when I was in tech school, one of my classmates was raising a puppy for Guide Dogs of America,
Mm,
and she was bringing her puppy with her every single day to school, and I thought that looks fun. I want a puppy I can take everywhere. And at the time I lived in a very tiny condo. I really wanted a dog between work and school. I was like, there's no way I could fit a dog in this tiny condo. My solution would be to get a dog I could take everywhere with me.
right.
So I started raising for Guide Dogs for the Blind.
Oh, that is so. Started with I see this dog with someone every day at school. What do you have going on? I'm interested in it. Now, it had to be some challenges with that. When you jump, did you jump 2 feet in, 1 foot in? How did you jump into it? And what was your like? Okay, what am I doing? Did I make a mistake, or was it just like sunshine and
All of the
rainbows?
all of the above. So it took some convincing to convince my husband to say, yes, we'll take on a puppy because let's face it, you're taking a puppy that's not necessarily yours. You have to conform to the training guidelines that the organization you're raising for has put
Mm,
out. And in a year and a half, you have to give that puppy back.
right.
So,
See, and that part is what I think a lot of people want. Like, how is it? Oh, because again, like, look at that bundle of joy you have over there, like five of them. Like, how can you give that up? Like, what? Like, was it hard for you to like say, all right, I'm raising this pup. I'm following the guidelines of the organization. They want me to be a part of this. Like, I'm all the way in. How does it feel to like give that puppy back at that time when it's like, like, how do you not fall in love and just keep them all?
you do fall in love. It is heartbreaking. Puppy raising is a roller coaster of emotions
Oh,
because you go through the hardest stage of having a dog, the puppy
mhm.
phase of them biting everything, chewing, going to the bathroom on the floor, potty training, crate training, the sleepless nights of getting up and having to take them out to relieve and putting them back in the crate. The hardest parts, teaching them to walk on a leash, all of it. to you now at the time that they're at that great age of, between 14, 18 months,
Mm-hmm.
this dog is now wonderful on a leash. It's fully potty trained. It doesn't chew up things anymore. It's not biting on your hands to now I have to give it back. But when my first puppy was a dream, he was like the perfect puppy. He was a black Labrador. And the short amount of time I was in the field and I had exposure to labs, I thought, they're going to be crazy. I'm ready for this. He's the most mellow dog on the planet, to the point where the first week I had him, I thought he was sick.
Wow.
Because he didn't cry. He slept through the night in the kennel. He was super easy to potty train. He was very settled, didn't chew on things. I was like, there's something wrong with this lab.
It's got to be something with this dog.
But he was a wonderful dog, and I took him everywhere with me. He went to school with me. He went to grocery shopping. He went to concerts. He went to the movies. He went to the mall. And when I saw his potential and how well behaved and how much he loved to work, when I turned him in for formal training, I was heartbroken, but yet also very excited to see what his future was. And then he was gone for 5 months in formal training, and then I got word he was graduating.
Wow.
And I got invited to go to his graduation ceremony, where I got to basically hand his leash off to his new partner. And the way he looked at his new partner after being paired for only 2 weeks, you could tell he knew where he belonged.
Right.
And he loved his job, and I stayed in contact with them, and I got updates, and we got visitations because he was placed, about 2 hours away from us.
That's
and
awesome.
I was hooked after that, because I saw the difference that he was making in somebody's life, and it was so rewarding and just really cool to be part of that experience, to the point where the day we dropped him off, we picked up our second puppy the same day.
You're like, we're in it. We're doing it again. We're
doing it again. And that was a completely different experience. She was your typical lab puppy that screamed in the kennel, that was super sassy. You asked her to sit or something, and she would refuse. And she was a handful.
Gotcha. So you were like, all right, we're yearning for that dog we got the first time again. So we're going to continue to do this over again. It's got to get better. That's awesome.
Yes, pretty much. And we did it about 20 times.
Wow.
Yeah.
Yeah. So what number puppy, do you know what number puppy you're on right now?
Well, technically I'm not really raising for another organization right now.
Okay.
So we stopped at about 20, and we raised for 3 different organizations.
Wow, that is insane. So walk us through that process. What is that process from the point where they are a puppy like you have now to the point where they are handed over to a person in need, whether it be a seeing eye dog or whatever that dog is actually using? What different services are you raising, or what organizations are out there that you raise puppies for different disabilities or services?
There are so many different organizations out there serving so many disabilities right now. So we raised for Guide Dogs for the Blind, we raised for Guide Dogs of the Desert, and we raised for Brigadier Service Dogs. And the guide dog schools mainly focus on guide work for people who are visually impaired. Mm-hmm. Brigadier was a different experience, because one of their number one placements is veterans with PTSD or physical injuries, or a combination of both. So we raised 3 dogs for them, and we had 2 graduate. One went to a veteran who both had PTSD and a physical disability. So he was trained to retrieve objects. The person walked with a cane. If his cane fell or anything, he was able to pick up objects. He was awesome. A great dog. And another puppy we had that's kind of a fun story was that she was a puppy that we raised from the time she was 3 weeks old with her 2 litter mates. And my coworker at the time was working at another clinic as well, like a lot of us do. We have multiple jobs. And somebody one night dumped 6 puppies that were 3 weeks old in her lobby. And they were Great Dane mixes. And she was looking for a foster. I said, I'll take half the litter. I can't take all of them. And as we were raising these puppies and saw, that they had potential, because we had been raising service dogs for so long, we sought out an organization that we could donate them to rather than place them with families. Oh. And so we found service dogs up in Washington, and they were willing to take the puppies.
That's awesome.
When we dropped the puppies off, they were short raisers. And so we brought one of them back and we raised her. She is a giant dog. She's over 100 pounds, and she graduated and was working with somebody who had some anxiety issues, but also some balance issues. So she was
Oh,
big enough to help with her balance issues. She helped her up the stairs, anything where she had level changes or fell
right.
off balance. She was trained to assist that.
That is, I
So,
didn't even think of that. I didn't even think of that, like being like, yeah, like you. Sometimes you need that leverage, right?
mhm.
That is, that is just phenomenal. That is, it blows my mind. And again, like I talk all the time about veterinary technicians, um, our field being so broad. And the thing is, and that's one thing I want veterinary technicians to know, technicians and nurses, like we get so caught up in the fact that we just do nursing care, which we actually do, right? And we think hospital. All we do is work in a hospital, which we often do 100% of the time. But there are so many other things outside of it that can spark your interest, right? That brings you in. And again, like for you, it's guide dogs. So, and again, that just kind of helps us like become better veterinary technicians, kind of do treatments better. My question for you is, when it comes to like as a technician working in the veterinary profession, what are some of those differences in how you actually treat your guide dog, or what information we need to know that we totally may not, I mean, I'm blown away already for the information that I didn't know about service dogs. But what is it like treating those patients differently, or what should we know as far as treating those service dogs differently than just your normal companion animal that comes into the clinic?
I think the biggest thing is to know that these dogs are more than just a companion. They're more than a pet. They're a lifeline. So the things that these dogs are trained to do, the people are very dependent on that dog to be in tip-top shape.
Mm,
And the bond they have with them is pretty remarkable. And they are super attached to their dogs, and they need, I think, more communication. They get very wary of other people handling their dogs, so they get service dog handlers tend to get very nervous once their dog leaves their side and goes to the back and not knowing what's happening with them. So when we've had service dog handlers come into my clinic and I'm there, I try to keep the dogs with them for as long as possible. If
mm-hmm.
there's things I can do in the room with them, I will. And just kind of explaining. The other thing is any type of medications we're giving these dogs, how is that going to affect their ability to work that day?
Right.
Things, oh, you want to help? You want to talk about this? Okay. Um, like simple, like say a dog presents for an allergic reaction and you give some steroids or some Benadryl. You're
Right.
going to have a sleepy dog. You may have a dog that's drinking more water that day and therefore needing to relieve more. A lot of people
Oh,
don't understand service dogs are on kind of a relieving schedule. They go to work with their handlers. And if you're in a meeting and your dog has to go to the
go out.
bathroom,
Oh,
you have like a set break time. Your dog is used to having a time to go out at this time. And if you change that or alter it, you could have an accident or have discomfort, or the dog may be unsettled and cause a disruption.
wow.
There's so much to think about that the average person doesn't, unless if you are exposed to these things.
Right.
Like one of the best stories I have that I tell people is I was at work one night and I had my puppy with me and I was needing to go into surgery and I know he was going to be in there for a while and I was tied up with this patient and I couldn't walk away. So I asked one of my coworkers, can you please take my puppy to go to the bathroom?
Mm-hmm.
And the thing is these dogs are trained to go with a certain cue or command. And so my coworker took him out, but she didn't know that he needed to be told it was okay to go. Because
Oh,
if you think about it, service dogs are out and about in all different situations. They're only allowed to relieve when they've been given an opportunity or permission.
wow.
And he refused to go because she didn't tell him he could go. So he was just like, I'm just walking up and down the street, no big deal.
And she's frustrated. Like, will you just use the
I don't
bathroom?
know what happened. So that's another thing that technicians can ask their service dog clients is if the animal is with them for any period of time and you need to take them out to go to the bathroom, what is their cue or command for them to go?
Wow.
So otherwise they may just hold it.
That is, again, like we don't think about these things, right? And we don't, and I appreciate, you definitely shining some light on this stuff for us, because again, I know owners have a lot of anxiety. I think the when I finally got, or that moment where I had like that moment of like service dogs are important, right? I had a guy came in, he had we work in emergency, and it was just that, that end of lifetime, and he was already prepared for it. In fact, the other dog, actually, I guess they were prepared that, this was a terminal type of deal. Dog was older, like 15 years old, but the younger dog, probably about 2 years old, was there as well because he was transitioning to be the new service dog. Like this dog, I guess he had already retired, but he was just his pet at that point, right? But he still knew how to work as his, pet, even though, and he was telling me how that it was a hard transition where he needed to let his dog be retired and this new dog work, but it's just that, like this is my guy, and his dog did not really understand that it was not time to work, being a retired service dog. But when we had to, like, humanely euthanize the dog because it was just that time, that compassion, that owner just wanted to just, it was just a different type of, like, when when we lose our companion animal, it's definitely hard. But when I saw this guy losing his service dog, it was a different type of hard for me. It was just like that was my lifeline. I'm leaving here without my lifeline, even though he had another dog already in training. But it's just, that's that compassionate moment. And before we wrap things up, because I know you got a lot to do with a lot of little puppies, what is the future, you would say, for growing up guide pups and just service dogs in general? Like, what is the future hold for that industry?
Well, for us, we're a tiny, tiny little nonprofit. We have no staff. Right now, it's really my husband and I. We have a few board members. Our main focus right now is service dog education. I'm really trying to get information out there to veterinary professionals on how these clients differ from your regular clients. And on top of that, the other focus currently right now is producing our puppies. So we have currently one standard poodle that's our breeder this is her second litter. So these puppies go out to small organizations that have very little breeding stock or no breeding program whatsoever. In fact, two of these puppies are going to brand new service dog organizations where they're going to be their very first puppies in training.
Wow.
Both of them are slated to go to adults with autism. One is a completely nonverbal person, and the other person is a high-functioning autistic adult.
Awesome.
Some of our previous puppies have gone off to veterans for PTSD work. We have a dog that is what they call a facility dog. She's paired with a mental health professional, and she works at a high school. So the kids make an appointment with the dog to talk about problems. They've found that dogs tend to open up the communication, and people are more apt to talk about traumatic experiences or issues to a dog versus a person. So you'll see dogs in courtrooms now or at police stations where people can give statements and they have the comfort of the dog. Their dogs are trying to put their head in people's laps or initiate petting to help calm people down and just make things a little bit easier for them. They're now giving out dogs to not only veterans, but first responders with PTSD.
Wow.
So, your firefighters, your paramedics, your police officers, there's a lot of things happening in our world that are very traumatic and leave a lasting effect. And these dogs really do help that. We have another dog that is with another nonverbal autistic child. And one of his main tasks is if he gets separated from his parents, the dog can find them.
That is
when
awesome.
I asked them how things were going, the founder of that organization that I gave that dog to said when she certified the team, they took the parents and the child to a crowded mall. One parent took the child completely different section of the mall while the mom stayed with the dog, and they told the dog to go find the child, and the dog led them straight to the child in a crowded mall. No questions asked, just directly straight. So if you think about it, if you have a child in that situation that gets separated from you and you can't call out, they can't respond back, you have the dog that'll keep track of them. Hearing dogs work very similar, where they alert their handler to noises. That you've got diabetic alert dogs that'll alert handlers to low or high blood sugar, which are very important, especially to families that have children. So dogs will be trained to sleep next to them, and if their blood sugar drops in the middle of the night while the parent's sleeping, they'll alert the parent that you need to do something about this. So there's cardiac alert dogs, there's seizure alert dogs, there's all kinds of different aspects. And so far we've got a pretty wide variety of where our dogs are going to. So we're
That is
super excited about that.
that is great. That is great. And, it just starts. We a lot of times we think about like breeding in vet med. We're like, oh, why more breeding? But then you think now, and now this is like this is a reason for it. We need those dogs that have that ability to work, and we need to pass that trait on for again as we continue to find more disabilities in the world where animals are a help. So for someone who may want to get into this, Amie, what kind of information? Where can they go to kind of look up information regarding this, or just information regarding how to maybe
Um,
think about getting into
you
this?
can, there's so many resources out there. You can hit up our website, growingupguypup.org. Um, one of the biggest needs right now in the service dog community is puppy raisers. Puppy raising
Mm.
for some is down. I think a lot has to do with the economy, and people are busy. But all of the organizations are really hurting for puppy raisers, and they're looking for somebody that's willing to take these puppies in for a year and a half, teach them basic obedience, teach them how to behave in public, and get the puppies the right start for the job that they're going to do. And a lot of people say, hey, why don't you use shelter dogs? And a lot of organizations will pull dogs from the shelter,
Hmm.
but they have a higher success rate when they're breeding for specific temperaments and traits and health. And all of our breeding stock dog go through rigorous health screening and temperament testing before we decide to breed them. And there's a lot that goes into it.
That is
So
awesome.
not every dog, yeah, not every dog can be a service dog. You need a very confident dog that's going to be able to handle the hustle and bustle of the public. If you think about it, I've taken dogs to Disneyland, Universal. I've taken
Wow.
dogs to BMX conferences, Western States conferences. It's a lot to handle. It's their long days, and these dogs have to be able to be focused and pretty much bomb proof and not afraid of things. So
That is awesome, man. I am so I'm blown away because again, I know a lot goes into this, and again, I've worked in different facilities where they had similar programs, and I'm always like, what are these kids doing all these golden retrievers, and what I got these little yellow vests on, and then, and now I realize like, oh, these are those year and a half puppies that have to be on campus. They get to see a lot of noise, they get to interact with people, so they do that again, that rearing up, and then they pass them along during the program. So that is awesome. That is awesome. Well, Amie, I definitely appreciate you taking the time out of your busy schedule um, to tell us about growing up Guide Pup. And again, can you just tell us one more time where we can find any information on growing up Guide Pup, or do you have a website, Instagram, any of that information?
yep, grownupguypup.org is our website. We're Grown Up Guy Pup on Facebook and Instagram, where I've been posting some photos of the puppies, and we'll keep track of them. They'll be around for about 2 more weeks, and then they're heading out to their various organizations. Everybody's spoken for, and I'm just trying to figure out which puppy is going to go to which organization at this point for the different jobs that they offer. So
Gotcha. I appreciate it. Well, Amie, if you would just hold on 1 second while we wrap things up. For all of you, man, we appreciate you all taking the time out of your busy schedule to chat with myself and again, Amie Chapman, who is a registered veterinary technician as well. And again, so many opportunities, so many different pathways into our veterinary space as a veterinary technician, veterinary technologist, or nurse. There's so many different pathways. And again, your interest may spark one way where you may have an influence in this profession in another way. So don't ever give up on your dreams. Go and search for your passion. Again, Amie, we appreciate you having us. And we will see you all again on another podcast in the future. Thank you all for being with us.